Hi, I'm Dr. Michael Stewart, a chiropractic sports physician right here in Glen Rock, New Jersey at the Center for Wellness and Rehabilitation. Today we're going to talk about a condition that affects a lot of people. It's called lateral epiconylitis or tennis elbow. This condition is characterized by pain at the elbow caused by inflammation or tearing of the muscle tendon for the extensors in the wrist. The muscles in the forearm actually help to increase extension or prevent flexion. This condition can be caused by a number of different things. It can be caused by carrying a basket of laundry. It can be caused by trimming your hedges in the front of your yard. It can also be caused by chronic overtraining in sports like throwing a baseball or playing tennis. There are a lot of different treatments for this condition, and it all depends on whether or not it's an acute condition or a chronic condition. Acute conditions usually occur within a 2-week period. So in other words, if it happens and then it's 2 weeks after it happens, that would still be considered an acute condition. As you get to 3 months, 6 months, or 12 months after the condition starts, that would be considered a chronic condition. If your condition is in the acute stage, most of the treatment that's going to be used is going to be to reduce inflammation and pain in the elbow. And then eventually, once the pain and inflammation goes down, then possibly strengthening of the muscle would occur. That would be a second stage of rehabilitation. What I'd like to do is focus on the chronic stage, because most people tend to live with tennis elbow until about 3 or 6 months down the line, and then they seek help. So when someone comes into our office and they have tennis elbow that's chronic, we generally utilize 3 forms of care. The first thing we'll do is utilize electric muscle stimulation, which entails putting these pads on the elbow, sending a specific type of current into the elbow to reduce pain. The second form of therapy that we'll use is laser therapy. We use the MR4 laser machine, which actually is one of the best, I think, and we use it at about 1,000 to 3,000 hertz, which helps to reduce inflammation and helps to regenerate healthy muscle tissue. Once we do that, we provide a therapy called instrument-assisted soft tissue manipulation. The reason why we do this form of therapy is because at the 3, 6, or 12-month mark, scar tissue starts to build up in the tendons and the beginning of the muscle belly, and that has to be broken up in order for healthy tissue to grow back. So we usually take a metal instrument that has a flat edge, and we just kind of rub it down the tendons to break up the scar tissue. This actually is the most important form of therapy because that's what's going to get the tissue the healthiest. Once the pain and inflammation reduces, generally we just do laser therapy to help regenerate healthy tissue and also the instrument-assisted soft tissue manipulation. At the end of the treatment, generally what we're going to do is put on kinesio tape. Kinesio tape is really important because it actually helps the muscle function when it's healing and when it's still injured. The way it does that is it actually provides sensory input into the area, and that sensory input, which is neurological, tells the muscle how to function better. All right, now we're going to apply the kinesio tape. All right, so what we're going to do is have Dr. Boyko bend her elbow at 90 degrees and the wrist also at 90 degrees. We're going to apply the tape right above the area of injury on the elbow, just to create a contact point. And we're going to apply 10 to 20% of tension into the tape as we bring it down over the muscle that's affected into the wrist. All right, we're going to pat it down to create a good seal on the skin. And what's important about this is that we want to make sure there's convolutions in the tape as she straightens and extends the wrist. So you can see at the elbow that there's undulations in the tape, and you can see at the wrist that there's undulations in the tape also. So now what we're going to do is apply a piece of tape that's going to help give support to the tendon as it goes into the lateral epicondyle. So what we're going to do is have her straighten her elbow, bring the wrist up, so we shorten the muscle. It brings the muscle belly closer to the attachment into the elbow. And then what we're going to do is apply a piece of tape to the forearm at about 50% to 75% tension, right over that tendon that goes into the elbow. And then we're going to lock it down at the ends just by pressing the tape down. Okay, so this blue piece actually gives support to the tendon, The white piece actually gives support to the function of the muscle as you're using to extend the elbow, wrist. So that's how we apply kinesio tape for tennis elbow or lateral epicondylitis. So if you have tennis elbow and you'd like to get help for it, we definitely have a very effective form of care for it. We use stimulation, we use laser therapy, instrument-assisted soft tissue manipulation, and kinesio taping. Usually the treatment program is twice a week for about 4 to 6 weeks, and by the end you should have significant improvement. Thanks for listening, and wait for our next video.